My name is Ivan. You can, just call me Ivan. I'm the dentist here, and just want to know from you guys, where are you guys from? Oh, we'll start with you.
From Valparaiso.
Valparaiso? Okay. And then tell me what got you to come to our event?
Well, about 50 years ago, I was in a car accident, and I had my teeth knocked out, my front teeth knocked out.
Okay.
And I've had caps and crowns, and now I have a cavity in my eye tooth,
Okay.
which is securing my. So anyway,
We'll be right back here.
Sure.
so I'm interested in this.
Okay. Great. How about you, sir? Frank, what about you?
Well, since I was a kid, I had a cap on just one front tooth, and I probably saw replaced it, put it back in on my own.
Okay.
And a few years ago,
It's on, Lenny.
It is on?
Yeah, she turned it
I
on.
was working in the mill.
Just ask Cassie. Okay.
It got to the point where the post wouldn't hold it anymore.
Okay.
So I asked about implants back then,
That was
about 5 years ago.
5 years ago. Okay.
And I've always been interested in implants, just for one tooth. That's all I wanted, the one implant.
Sure.
And they said, no, that's cosmetic. Insurance won't cover it.
Okay.
So instead, they said we're going to have to put a bridge in. So they yanked 3 teeth to put one bridge in, to fix one tooth.
So they cut down 2 healthy teeth.
They pulled 3
Pulled.
teeth
Okay. Okay. Wow.
for one tooth.
So they made from a 1-tooth problem, it went to a 4-teeth
Yeah.
problem. Right. Partial. Okay.
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 Now I got this, I had a welding burn. A spark got in my tooth.
Thank you.
Now that, and I said, I'm going to have that dentist work on me. Now I'm retired,
Right.
and the tooth is starting to get real bad.
Okay.
And I'm thinking about getting the implants on these 2 front teeth. I'm not worried about the size.
Sure. Okay.
But the only thing I'm interested in is the price.
Sure.
What's it going to cost me?
Right. We'll go over all that.
And that's all I care about, because I know what implants are and everything. I just want to know what it's going to cost me out of my pocket.
Sure.
Because insurance ain't covered, and I don't have insurance.
You guys together?
No.
I don't have insurance, so because I'm retired now, I don't have dental insurance, so I want to know what's going to cost me out of my pocket. That's all I care about.
Okay. What about you? What's your story?
Oh, just continuous problems right now. I just had all my 22 teeth pulled out, and I'm in the process. I'm in the 4th month.
Okay. Dentures?
And, pardon me?
Dentures?
Yeah.
Okay.
And I'm happy about where I'm going, and so I want to know about the implants. I want to know about the snap-ons. I want to know about the mini implants. I just want to know the variety of what's out there.
Sure. Options.
That is an option to me.
Absolutely. How about you, Russell?
Yeah, I'm having trouble chewing my food. I only got about half of my teeth left, and I got a partial, but I can't wear it. It's painful, and it cuts the inside of my mouth all up.
Okay. Sir?
I just went checked into it.
Yeah.
I got dentures. I don't like the fit. The bottom one flaps around too much for me. It's uncomfortable.
Okay.
Looking something different.
Sure. How about you, Catherine?
Okay, I don't want dentures.
Right.
I've seen people with those and lived through that with my mother and my husband. I'm interested in implants. I have been for the last couple of years. Went to one individual and wasn't satisfied with the information that I got. Also, I want a one-stop shop. I've talked to some people. This dentist implant person will do this, but then you have to go here, and then you have to come back, and then you have to go someplace else. And also, I'm interested in cost.
Sure. Absolutely. Mrs. Vivian?
Well, I guess I could say I'm dental phobic. I'm not afraid, I'm not frightened, I'm not petrified, I'm totally mortified, okay?
Sure.
For me to be here is a
And
big
you're not alone.
step.
You're not alone. I really have to respect and commend you that you actually took the step to come. And that takes a lot. And that's
And
half
I was
the
only
battle.
in reading your reviews and online and on CNN, and it kind of relaxed me to the point where I felt I could make this first step.
Okay.
I never had good dental care as a child.
Okay.
And unfortunately, I'm approaching 60, and I don't know why at this stage of my life, but I'm sure it's impacting my health.
Okay. Sure. Linda?
I have a 5-unit bridge that has a cavity underneath it, and it's just a matter of time before, I'm just biding my time until it falls off. It needs to have something done, probably an implant to hold it on.
Okay.
That's what my dentist recommended anyway.
Okay. And you're all from
Griffith.
St. John?
In Chicago.
Chicago, so just hold the whole
I'm
tri-town
from
area.
DeMont.
Okay. All right.
My wife would have been here, but she had day off. She works right down the street.
Okay. How about you, sir?
I'm just here for the information.
Okay. Great. Thank you very much for sharing every bit of information about where you're coming from, and you all are the type of patients that I see here in our practice every day. Just want to go over a little bit. We have a full, you talk about one-stop shop. We have a full-service office. We have, I myself, who's the practice owner, and we have 3 other dentists that are working here. My role in the office is to provide dental implant care and sedation care for patients. We do from 1 tooth to few teeth to all their teeth missing, and we're going to go over all the options. Today my job is here to just educate you, let you know what options are out there, how technology and things have changed. Then you guys will make it, you guys are informed consumers, educators. You guys know exactly what decisions you'll make, because there's so much information out there. Come on, let's face it, you guys are being bombarded with commercials, radio commercials, newspaper ads, this and that. You don't know who to talk to, who to choose. So hopefully after listening to me, you'll have some sort of a clear idea of what's out there, 21st century approaches, and what options works for different people. So when I talk about dental implants, which is my passion, just keep on making sure it's on. Okay. I have this picture, and you guys might have seen this in one of our articles. The teeth in a glass. I have made dentures for my grandparents, both of my grandparents, my mom's side and my dad's side. I've had multiple sets made. They never liked the dentures that I've made. I mean, I went through all the textbooks procedure of making the dentures, proper fitting and everything, but after a while, they just kept on complaining. It's loose, it does not fit, it's cutting here. There's a reason why, and I never understood bone biology back then when I first graduated from dental school. But maybe you guys know now, but maybe you haven't been told before, but when you lose your teeth, or when you lose a single tooth, that bone is always shrinking. It's never coming back.
It degresses.
Huh?
It degresses.
Yeah, it's use it or lose it. That tissue, if it's not used, you're going to lose it. Unfortunately, you're not being informed by that by your dentist or whoever you go to. So if the bone isn't function, bone needs stimulation, or bone needs stimulation from teeth or teeth replacement with implants, whether it's 1 tooth, 2 teeth, or 3 teeth. So that's why I'm so passionate about giving people teeth for chewing and functioning. That's why I always like to say that really no one should die with their teeth in a glass. That you should be able to enjoy your quality of life, so you can chew, smile, and not only you'll be happy, but everyone around you will be happy. This is how I remember my grandparents, because they had their teeth in a glass. I have this slide. This is just a handful of people that we've treated. This is just a handful of people we've treated, and the majority of these people were either denture wear, people that have had dentures, or people that had really bombed out teeth and that couldn't be saved, and they were told that your destiny is dentures. Your destiny is nobody even talked about implants. And they sought us, and we actually changed their lives. So all of them are very, very, very happy patients of ours. Credentials. When you choose somebody to have your dental implant care, check their credentials. Credentials are very important. There's a lot of people that are saying they'll do implants or they'll do mini implants, but I'll go over all that later on. But you have to look at credentials. Are they being credentialed by International Congress of Oral Implantologists? Are they a diplomate? Are they a fellow? Those are very high-level credentials that we have to attain to go through some regulating bodies to actually do these high-level procedures. Okay, so
What does fellow mean?
Fellowship is somebody that has gone through additional training outside of dental school, have gotten extensive training.
So there's like member and fellow and stuff like
somebody
that?
has gone through some certification, somebody's gone through some examination process. That's a fellow. To take it one step higher, you become a diplomate. Okay, diplomate is when you're on the top, where you have done all kinds of cases to present to a board, and the board says, okay, we're going to give you your diplomat status because you have the ability to handle these cases. That's a diplomat. And over the last few years, I've gone above and beyond and got my diplomat status, not only in the International Congress of Oral Implantologists, but also American Dental Implant Association. I'm also a board of director on one of those organizations. So that shows my passion towards the whole field of implant dentistry. I'm not going to go through all that, but my passion is dentistry. So my actual training actually started when I finished dental school. Dental school provides you with the very basic knowledge, but most of my education started afterwards. So I've traveled all over the world to learn from the best mentors to give my patients teeth for chewing and functioning, and not somebody that just goes to weekend course and just gets certified. You know, most dentists require 32 hours of credit to renew the license. I myself have taken anywhere between 200 a year. Okay, so I just keep on learning. The learning never stops because every 5 years, technology, procedures, everything change.
Just like a
What's that?
Just like a computer.
Absolutely. Absolutely. That's what I asked the patient. Do we still use MS-DOS? No, we don't. We're Windows 7 or Windows 8? No. Again, it's just there's some of those organizations that I belong to. Technology is very, very, very important. Technology is, you know, I call our office, we're very high tech, but we're also very high touch. We never lose the human element. You know, when I say that when we say we treat you like family, and you will see when you talk to some of our patients, and I really mean it, because we treat you like family is not just a slogan, because I really care for each and every person that I treat, and each and every person that I treat will get my cell number if they have any questions, any concerns after the care. This is a picture of a lady that's eating apple. This is what I want my patients to do when they're done with their teeth, and our patients have actually done that. They're able to chew apples, chew nuts, chew steak, eat what they want to eat, not what they can eat with dentures and partials, or with teeth. This is one of our visions of our organization. Our vision is to give you back your smile and function, so you can eat and you can be happy. What is the most simple pleasure in life? Eat. You know, I get so many patients that I see, that I talk to, says, I haven't had steak in years. I haven't been able to taste my food because I have a denture and it's covered my palate. I gag. So those are the kind of things that our patients tell us that we can eat, we can smile. When I take pictures with family, I cover my face. Patients tell me that, and those things are very important. We take all that into consideration because patients are not being educated about their options. As I mentioned earlier, we help people with one tooth missing, a few teeth missing, or all their teeth missing. We have a large team. As I said, this is a one-stop shop. We have a general dental office. We have 3 other dentists. We have hygienists. We have assistant. The other side of our practice, our specialties practice, where we have our outpatient surgery center, where we perform life-changing procedures for patients that have really bombed out mouth and give them teeth, or patients that are wearing dentures that require teeth. And this is the team that you guys will meet as you guys get done here, that will handle you from the surgical, from making your appointment, and making sure that your care is streamlined throughout the entire process and your follow-up. And this is, right here is my surgical and prosthetic team. This is me, this is Jen, my surgical assistant, Beverly, and this is Tony, the gentleman that you met when you guys came in. He handles all the lab, the prosthetics, and he's the person to talk about teeth selection, what kind of smile you like, and all that, and we're going to get into all that when we get into our presentation. These are team members over our general dentistry side, where we see kids from all. We see kids, we see teenagers, we see parents. We do fillings, we do partial extractions, 1-visit crowns, 1-visit root canals, everything. And these are the team members that help you go through your general dental visits. These are the lovely ladies over here in the front that you guys met when they came in. What makes our team different? Okay. 1 doctor, 1 building, 1 location, all your care in 1 location. Okay. When you come for consultation for dental implants or sedation, I do your consultation. Who does your sedation? There's no other third person does your sedation. I do your sedation. Who places your implants? I place your implants. Okay. who does your restorative work? Restorative work is very important. Restorative work is the teeth, placing the teeth on the implant. Right now, the general, in 95% of the profession, it's like you go to, your dentist sends you to an oral surgeon or a periodontist, okay? So you got to drive all over town, okay? That person tells you, this is what we got to do. We got to coordinate your care with your dentist. Well, this guy is just going to have one fees. This guy's going to have different fees. How is your care streamlined? If somebody who places the implants and somebody who does not know how to restore the implants, it's just actually going to affect you as a patient. And I see patients like that all the time. But when you have one person that is trained in surgery and that's trained in doing the teeth, it makes it just one person overlooks your care with their team, and it makes your care much better and much more streamlined. You're only dealing with one person and the team members. Follow-ups, you do with me. Emergency calls, I will. If there's any emergency calls, we have 24/7, 365. You can actually call the office. We have a call center. The call center will get a hold of me, and patients are able to get a hold of me readily all the time. Other offices clearly don't give you that choice. They really don't give you that choice, because you may get a hold of somebody over the weekend. If there's no call center, there's never a live person. Okay. Also, we are eons ahead. When I say eons ahead, meaning we are ahead of anybody else. And I will make a very bold and a blunt statement. We are eons ahead of any other dental implant center in the area, and even in Chicago, because the kind of level of care we provide, nobody else is really providing, and you'll see what I'm talking about. Because we're doing very current 21st century, minimally invasive, less costly, and less time-consuming approaches than what you may have heard about with traditional approaches. Also, this is very important that I like my patients to understand. It's very important that somebody who places the implants also does the restorative work. Restorative work is the one that gives you the teeth. Whoever touches the patient last is it. If your oral surgeon places the implants and you go to your general dentist and they mess up placing the teeth, you're going to go after your general dentist, not the oral surgeon. That's just the way it is, because ultimately what patients want is teeth. They don't care how the implants are placed. They don't care when the implant. They are concerned about teeth. And somebody who, this is our philosophy. Our implant surgeries are driven backwards. We know where the teeth go. When we know where the teeth go, that drives our implant surgery, because then the results come out much better, and not only but function, but aesthetics, because what everybody wants nice looking teeth as well. We have a full-service dental practice. I place the implants with my dental assistants, Jen and Beverly. Tony, the dental technician, fits the temporary teeth. I complete all the final restoration. I do all the pre-op appointments, and again, I handle all the emergency calls. I tell this to the patients that I see: losing your teeth. Okay, people lose teeth for a lot of different reasons. It may not be a choice. Maybe it could be genetics. Maybe it could be medication, maybe it could be medical history, it could be life circumstances, anything. Maybe you just got busy with taking care of your kids, putting them to college or whatever. Things happen. Sometimes we don't have a choice in life. But, however, getting your health, getting your aesthetics, getting your biology, your personality, and having your quality of life is a choice. So if your destination was there's no hope, if your destination was you only need dentures, rethink. I'm going to kind of try to get you guys to think differently. There is a hope there, and that's your choice. And also picking the right provider that gives you all your options, and just say you don't need to have this done. You only need to have one option. No. When we talk to our patients, we give our patients multiple options, and then let them decide what they want. Okay. You're going to see when you leave here, your journey starts here. This is a X-ray. Everybody's used to dental X-rays. Everybody had panoramic X-ray goes around your head, right? Dentist holds up a sheet of paper that says this is your bone, this is your sinus, whatever. We've taken it to one step further. We have a 3D dental scan. 3D dental scan. I don't know if anybody had a CT scan in the hospital, but you go into a medical grade CT scan, you go into that little spiral little thing. Okay, it's nothing like this. It's in 18 seconds you are done. It's just like having a dental panoramic X-ray, but it gives me a three-dimensional picture of your teeth, your jawbone, your sinuses, your nerves, your eye, your everything. Because what it does is it takes all the guesswork out of where the implant should go. I know exactly where your sinuses are. I know where your teeth should go. I know where the nerves are. So that helps me plan the surgery, because that is very, very important. Somebody that goes on two-dimensional X-ray, well, with the panoramic X-ray, it's a lot of room for error. You know, I've seen patients that have had implants placed close to the nerve. I've seen implants placed close to the sinus. You know, then there's a lot of problems and infection that are associated with it. We're one of the few offices that have this technology in the office. It's a 3D dental scan, and it really helps us provide the best care to our patients. Edentulous means teethlessness. How do you fix a problem? When patients come in, maybe some of you've got our packets, and this is some information we provided.
Okay, with that CT scan, can you use that with a pacemaker?
Absolutely. Absolutely. It doesn't, because all we do is we just take a scan of your head and neck. That's it. We're not worried about anything else. It's just right here.
Because I'm pretty sure that I think IUN did it to me, gave me a scan or something.
Okay.
At IUN, they took X-rays of somehow.
Okay.
So they have the X-rays at IUN if you need them.
Sure. Whatever you have, we'll be happy to take a look at them.
I just gotta get a hold of IUN and they'll send it to you. They
Sure.
won't give them to me.
Right. We just had to sign off on it.
Yeah.
We give options. You know, we can do conventional, multiple implants. We can do 4 to 6 implants and fixed teeth. We could do a snap-on denture, and last but not least, we can do dentures. So again, we give option to our patients when they come with either broken teeth or with dentures. Who can benefit from dental implants? 15% of those over 55 years of age are missing their entire upper or lower teeth. That's 15% in the United States. The United States population is 270 million, so if you take 15% times 270 million, you can kind of figure out how many people are with their entire upper or lower teeth missing. 5% of those age 40 and 44. So we're living longer. There's no questions. We are living longer. My grandpa just celebrated his 90th birthday on Saturday. So we are living a lot longer. We're living, and we want to enjoy our quality of life. But what's happening is that our teeth they break down. They wear and tear. Those large fillings break, and when you wear dentures at an early age, you're constantly losing that jawbone underneath. 26% of those aged 65 to 74 are missing all their teeth. So the numbers keep on. These are just statistics from the health department.
Is that why the insurance won't cover implants?
Well, let's not even get about insurance, because if it was insurance company, it was only going to cover most basic care, which is preventative checkup and cleanings. And dental insurance is it's more like a benefit. It's not really insurance. And medical insurance is for when you have catastrophic, you have a car accident, you have an open heart surgery. Medical insurance takes care of that. Dental insurance is just a benefit. Unfortunately, it's been like that since 1955. Those without teeth, and this is a fact, health. Those without teeth don't live as long as those with teeth or implants, because for those that want to live longer, implants may help, because I tell you the digestion starts right here. When you're able to digest your food, you're able to get better absorption, better nutrition, better quality of life, better cardiovascular health, less fatty and food intake. People that wear dentures have a very high fatty and carbohydrate intake because they can't chew their food properly. They can't eat green leafy vegetables. But when you have teeth, healthy teeth, or you have teeth replacement, people are able to eat properly and live longer. Why are implants better than dentures for eating? Well, a little bit of physics. Natural teeth have 150 to 200 psi of chewing power. That's huge, okay? Set of dentures only have 50, okay? 80% less than natural teeth, okay? So you can't really chew and break your food down. After 15 years, the PSI is only 6. So after 15 years of wearing an upper or lower denture, you have 98% less power of chewing. So I remember my grandparents, when they had dentures made, multiple sets made, they would just take them out and say, I'm better off eating without them, because I'm so tired of them cutting into my gums. Implant can restore, and I'm being very conservative, implant can restore 90% of your chewing pressure of your natural teeth. So if your natural teeth are gone, like I said, that may not be a choice, things happen in life, but if you restore your natural teeth with dental implants, it will restore your chewing function back. Does nutrition suffer? Absolutely. With dentures, you only get 2% chewing power. That leads to high carbohydrate, softer food diet, cause weight gain, and further health problems. Okay? It reduces the ability to taste your food. It makes eating favorite foods very, very difficult, because we get our food from the palate. The palate is covered. We can't really enjoy our food. Does poor nutrition from dentures create health problem? Absolutely. More illness due to suppressed immune system. Poor nutrition means more health problems. Decreased life expectancy. It is known fact that people with healthy teeth or teeth replacement, they live 10 years short. They live 10 years longer. So if you've been wearing dentures, the lifespan is absolutely 10 years shorter than somebody who's had a good set of teeth. Increased chance of death by choking on dentures, and I've heard about this. People that wear dentures at night, they don't take them out for giving their jaws to breathe. Sometimes if they slip, they can actually go in their airways and cause airway obstruction. More need for prescription drugs, especially stomach and intestinal problems. A lot of people that wear dentures have a lot of intestinal problems because of poor digestion. Can implants improve one's facial appearance? Absolutely. They help with premature aging by providing a lift just right here, mini facelift to the lower 1/3 of the jaw without having any facelift or plastic surgery. Bone loss around implants, however, is less than 1 to 1/16 inch over 20 years. As we get older, you're going to lose bone. You're going to get periodontal diseases, pyorrhea. Everybody's heard of periodontal diseases. With implants, it stops the bone loss process. 1 to 1/16 inch over 20 years. You get very minimum bone loss around the implant. That's the most secure connection is with the bone to implant. Okay, you knock out, you get into an accident, your entire tooth will knock out. But if you get in an accident, your dental implants, your implants are not going to. They're going to stay in the bone. That's how strong the connection is. A edentulous mouth. Edentulous is again all the teeth missing. The bone deterioration affects the face, and it makes one appear older. When teeth are missing, the jawbone deteriorate, dissolves, partial indenture actually speeds up this process. The visible changes are a lot of patients get bulldog appearance in the corner of the mouth, frowns, thinning of the lips thin out, especially the upper lip, increased frowns in the corner of the nose, increased lines at the mouth. So a lot of these things that happen, and I see patients that wear dentures have that. How about having a nice white teeth again? Denture teeth usually are very lifeless. Okay, just your everyday denture teeth. It's important to have somebody who finds cosmetic in denture also, because when we do teeth, when we also do dentures for patients, we do cosmetic dentures. We can make dentures that make it look more lifelike, a little more aesthetic. Some of our patients in some of the lectures I've done, in some of the cases that I've shown to some of the other dentists, they didn't think that they were denture teeth, and they were actually denture teeth, but they were nice looking denture teeth, and they were from Switzerland. They're called Swiss teeth. This is very important, and I don't know if you guys know it or not, but nowadays the denture glue, Fixodent and Polygroup, there's a huge problem going on right now in the marketplace. Procter & Gamble, I see heads going like this. Procter & Gamble, FDA is coming down hard on Procter & Gamble and the manufacturer of denture adhesive. That there is zinc in denture adhesive, and that is causing a lot of problems. I'll tell you, the FDA regulates denture adhesive, which are medical devices under Food and Drug Cosmetic Act. A denture adhesive device intended to apply for base of denture before denture is inserted. FDA has classified this product as low-risk device class 1. While manufacturers are not required to submit marketing for class 1, they are still register and list class 1 devices. Basically, all it is saying is that neurology is the science of learning the central and peripheral nervous system, your brain and your spinal cord. There is a journal after journal that denture cream causes neurological problem, and I'll get into what kind of neurological problem it caused. From 1990, Procter & Gamble added zinc to Fixodent, and then in 2009, this law firm appears on Good Morning America and denture cream lawsuit. Okay, files 15 denture cream case in federal and state courts. This law firm appointed to leadership in federal and state court legislature. There's a huge problem right now because these patients have actually complained of numbness, memory loss, tingling, and a lot of other neurological problems that are associated with denture cream. Brands of denture cream, Polygroup, it's poison. It's not good for you. It's not good for your health. Fixodent, Fixodent Complete, Super Grip, all these some symptoms that have been reported by patients and been documented in journals are loss of feeling in extremities such as fingers, hand, toes, and feet, difficulty walking, fatigue, edema, hair loss, anorexia, diarrhea, lack of balance and general instability. And these are all that came from Neurological Journal, and this is something that I really we're educating our patients on that if you have been living with denture cream, please rethink about your options because it's not good for you. Do implant prevents further tooth loss? Implants help prevent further teeth from being lost, absolutely. The reason why is, I'll give you an example of one tooth. You had a bridge. If you have one tooth taken out, and if you don't replace it, if you leave it alone, the other teeth are going to shift. When the other teeth are going to shift, you're going to lose bone around it, and eventually it's going to cause a domino effect, and it's going to cause loss of those teeth. So yes, by having, it may sound very drastic, but it is, but one tooth loss can cause further teeth to be lost. Partial dentures and bridge work greatly increase the risk of losing more teeth due to excessive dredging and unavoidable stress. When you wear a partial, something that comes in and out, okay, it has those hooks and clasps that actually puts a lot of torque and stress on the teeth, and eventually those end up being lost. Success rate. Success has never been very better. Again, 95% success overall, and again, that's being very, very conservative. There's more success, and again, this is very important to understand. I'm comparing it to knee and hip replace. Anybody that had knee and hip replace, there is a 20% reoperation in 10 years. If you go to a good orthopedic surgeon, they'll tell you the risk that in 20 years, in 10 years, there's a 20% chance that you may have to have your nip or knee replaced because of the wear and tear. Dental implants are not like that. Once you have a dental implant placed and once it's fully integrated, okay, integrated with the bone heals around it, it's there for life, okay, unless some major medical illness or disease happen that involves your bone, but otherwise you're never going to have reoperation. Even, you know, you can chew 200, 300 psi with your implant teeth. You're never going to need to have reoperation again. Artificial eyes are also more successful, but they do not restore vision. So I just had to compare it to other medical-related prosthesis. Again, the other thing is treatment time has gotten shorter. Absolutely. Treatment time has gotten shorter. Now, I don't know what you all may have heard, but the traditional approach is if you don't have teeth, you got to get bone grafting done. You got to have bone augmentation. You got to get billed. You got to take bone from here. You got to take bone from the chin, bone from your tibia, and you got to have your sinus grafted, and you have to wait. You have to wait a couple of years for the bone to heal, and then have the implant placed. Wait another year for the implants to place. Then open the implants, wait another couple months to put the abutments on, then put the teeth on. From the time you start to the time you finish, you're looking at 2 to 3 years, and you're still walking around with no teeth. That's the traditional model that's still being practiced, unfortunately. So the treatment time has gotten absolutely a lot shorter to a point where you can actually have teeth in one day. Okay, and that's where we're going to go over as to how. In some cases, 12 weeks compared to 24 months. And again, I just give 12 to 24 months in the past. I'm talking about when you're finally done. But you can, if somebody's a good candidate, we can remove bad teeth, we can put the implants in, and we can fit the teeth on all within a day or two. Okay. Treatment time any shorter than this are not unlikely because Mother Nature doesn't have limits. Can you have all your care in one office? Absolutely. It's in one location. Somebody said, you know, one-stop shop, less hassle, more convenience, fewer visits. You don't have to run all over town, and absolutely less cost to you because traditional approaches cost a lot more expenses, more downtime for you. Going from office to an office costs you a lot more time and a lot more money versus being in one location. Patient stories from our patients. Maybe you know a friend or a coworker or a family member who has had this done. Compare your stories and see what they've said, you know, what they've had done. People who are either missing their teeth, either they're afraid of the dentist, or they're unhappy with their dentures or appearance. You know, let them know about us, what we can do after you're done, and you know, whatever you guys are going to do afterward. Our goal is to help you in any way possible. Now I'm going to get into 21st century approaches. This is what we provide for our patients. Although in my treatment options I will mention the traditional and standard approaches, but this is the more 21st century. This is more minimally invasive, less costly, and less downtime. Okay, and here what I'm talking about, it's for total rehabilitation of your upper or your lower. It is for somebody who is missing all their teeth or people that are about to lose their teeth. This is what we do for them. It's called the all-on-4. Has everybody heard about the all-on-4 dental implants? Anybody heard about the all-on-4? Okay. Basically, all-on-4 says that we can build your entire upper jaw or lower jaw on 4 special place implants. Okay? 4 special place implants. Okay. What is it? what does it for our patient is, what it does for our patient is gives them care that would usually take 1 to 2 years to complete. We are giving our patients much more affordable care in just a matter of weeks, and I'm talking about, I said weeks here, we can do this within a day, okay? Where 4 dental implants, special place, teeth go on it, and, you know, are you done? No, you're not done, but these, I'm gonna go over that these are your first set of teeth that you leave with, but you leave with teeth. You don't leave with dentures. You don't leave with false, you don't leave with no teeth, with traditional approaches. Is this a new procedure? Absolutely not. It's been around for 15 years. Over 20,000 have been done in Europe and all over the world, and it's been FDA approved in the United States for the last 5 years, and with 97% success rate. Do other practitioners offer it? I don't know. Okay, I know that we offer it, but I know in the Northwest Indiana region, absolutely no one is trained to do it because I know. The all-on-4 is being performed by very, very few of us in the actual United States, okay? In our office, again, is the only office in Northwest Indiana that is certified and trained to do the all-on-4 with hundreds of cases under our belt, hundreds of patients under our belt that have had from their first time they called to the time they got their permanent teeth, as to the success rate have been very, very high. Why all-on-4? I'm going to go back to the other slide. Okay, you guys see how these back implants are tilted, right? Everybody's back implants are tilted. Okay, when you tilt the back implants, you're able to put teeth much further back. This is not a denture. This is a fixed bridge. This is no different than the newly designed bridges that are designed in all over Europe and even here. Is instead of having an individual beam for all bridge, you have few beams, but they're annulated, and that supports the whole structure. So most modern bridges use new design under computer stress analysis. The rigid frame type has superstructure and substructure which are integrated. Commonly, the legs or the insertion legs are single piece, which are rebated in other sections. So this is no different. I just had to compare it that this is how we design a restoration for our patients when they need total oral rehabilitation for the upper or the lower. You don't need to have implant for every tooth. I'm sorry, but it is preposterous to have an implant for every tooth because the more you drill into the jawbone, the more you weaken it. If you are a good candidate and we can do 4 to 6, that's all you need to get your full chewing function back.
I have a question for
yes.
you. When you put those in, and I know that you screw through the teeth.
Yes.
Okay. What would stop you, like dentures? You know, no matter how tight they fit, there are going to be times where they're going to rock on you.
Correct.
And you're going to get particles underneath.
Right.
Okay. What would stop you from getting particles underneath there?
You will not, because this is how a all-on-4 implants look like. Okay, I'll pass the model around. When these teeth are fitted, these are when your first set of teeth. You know, when you have on the day of the surgery, you may get space there because when the gums heal. But when you get your final set of teeth for life, which has titanium on the inside and porcelain acrylic teeth on the outside, when it's secured, it's a pressed firm fit. You're not going to get that hamburger, that pizza, that lettuce. It's not going to get underneath there. That's not.
What about popcorn shells?
What about shrinkage? As you get older, you're going to shrink anyway.
It's not going to shrink because the implants prevent the bone.
That's not going to shrink, but you're going to shrink.
And you're not.
You don't shrink?
You're not
I thought
shrink.
you lose bone and
You lose
tissue.
That's if your bone is not, no teeth are there.
If no teeth are there and if no implants are there, this is going to prevent the bone loss.
I thought you lose anyway, even if you had your own
You
teeth.
turn over like 0.4% of your skeleton every year. Okay, but if you don't have teeth replacement, if you don't have implants to hold your jawbone, if they're not in function, your jawbone's going to be more and more rapid. When you have implant teeth, we have biological studies that even though you shrink and your height shrink, but your jaw, because you're using your jawbone, you're eating, you're chewing, so you're keeping that tissue alive. It does not shrink.
So your jaw doesn't
That's a good
shrink.
question for Ken to answer when they go next door.
Yeah.
To ask him.
Who is this, Ken?
Ken.
Yeah.
Has him talk about that too.
We have a patient next door that you can actually talk to them about that too.
And when you have the temporary sound,
Yeah.
they just fit over the post, that ceiling, is that what's going on?
Yeah. Absolutely. Are you okay, sir? You okay?
Yeah, I gotta get some oxygen, it's getting low.
Okay. Okay.
Do you want to step in the hallway?
Huh?
Do you want to step out into the hallway?
No, that'd be all right.
Hey, we get patients that have no bone. Okay, absolutely no bone in their upper jaw. No problem. We have the solution. We use the long implants. Instead of getting your hip, getting bone from here, instead of getting bone from your knee, your tibia, or your chin, doesn't matter. We don't need that. You can use what we call zygomatic or long implants, and that are able to give patients teeth immediately. Okay, that's again, this is all 21st century approaches versus having bone graft, sinus lift, all that delays time, and plus 50% of the sinus lifts that are done, they fail. They fail. They turn into infection. I'm gonna. Tony, our patient, was very nice enough to talk to you guys about what she had done in our office. Tony, this is actually her X-ray. Tony had sinus lift done twice at the university. She had the bone graft done, and it failed. And instead of me talking about it, I'm going to let Tony see if you can listen to what, how things were with you and what things got done. Can you share a little bit about that?
3 years ago, I went to the University of Illinois, and I wanted implants. So they said, you don't have any bone. So they did a bone graft, and I can't say the word cadaver from, they used that bone. Okay, within a week, it got infected. It all had to be removed. So then the next year, they said, you have to let that go. They said, next year, what we're going to do, we're going to take 4x4 piece out of your hip, which they put me in the hospital, and I took the bone, they crushed it all up, and they filled it all in my mouth. Within a week, that got infected. They left it infected for 1 year because he wanted to keep that bone in there, so he has some place to attach those screws to. And went through hell. I really did. And then I came here and I said, I want to have some teeth. So he just put the screws in 8 days ago, and I got teeth. No problem.
So they're not your permanent teeth, though?
No.
These are temporary teeth.
Okay.
And I shared this story with one of his girls tonight, was that I guess I'm like my father's Hungarian, and we're considered to be like cheap people. But basically that was, I didn't want to spend a lot of money. So, I'll go up there to the university where you have a dentist on the 3rd floor, you have surgeons on the 1st floor, but oh wait, they graduated, so now then you have another surgeon, oh, that one's done, now you got another one. And by then nobody knows what they're doing or what they had done. The 3rd floor don't speak to the people on the 1st floor. Oh God, what a mess, But my father, not about implants, but he had TMJ, he had a lot of pain in his jaw. And so he's cheap like me. He went around finding the cheapest cost. What's the cheapest way I could get this fixed? And he found a dentist, and the dentist said, I could freeze that permanently. I could give you an injection and do it permanently. My dad said, okay. He got a shot that day, and that night the fluid went and paralyzed his, what is that thing in the back of your neck? My father never ate or walked again because he tried to save money. So my point is, go to somebody who knows what they're doing. Don't try to save money, because even I put myself in risk going up there to Chicago to have 1 year, 1 full year of infection that's pus running out of my mouth on a non-stop basis. Being on antibiotics after antibiotics, So if you're going to do it, go to somebody who knows what they're doing. That's about it. I like my teeth.
She just had her
8 days.
About 8 days. She just had that done under sedation, and we're just waiting for healing to occur. And then when healing occurs in 3 to 6 months, then we'll give her final teeth. So I just wanted to share that story. That Tony has been told that she had no hole. She's had a denture that she didn't wear for a long time. But again, actually going through bone grafting and turning into infection, it wasn't fun for her. And again, it could have been avoided if if they would have approached it in a different way like we did. But I just wanted to share that with you, because it's all about options. It's all about the technology. It's about how you're able to give your patients teeth in a lot less time. Who invented the all-on-4? You know, this is he's one of my mentors. He's out in Lisbon, Portugal. Dr. Paulo Malo. If you guys learn about him and talk about it, he's actually I know him personally. I've trained under him. I've trained with him over the last few years. He's the one that developed the concept that has revolutionized and changed the way we practice implant dentistry these days. Questions we get asked is, will I be out for the procedure? Absolutely. Our patients will go through sedation. You know, we take patients based on their medical history from light all the way to pretty deep level of sedation. So patients are comfortable. We give IV through the sedation. Patients have very little to no memory left the next day, and it's just much better. And then patients have very minimal swelling and pain because we give medications through the IV to make sure that you're comfortable, and pain meds, anesthetic, and also a lot of antibiotics. Also, the reason why I have this picture is people that doesn't have a ride, we actually will provide a ride for you. We'll have a limo or a town car pick you up the day of, so that way you don't have to inconvenience anybody. Because you know, when you come, you're going to be pre-sedated, so we want to take the stress out of you completely. If you can't find a ride, we'll be happy to provide the information, the limo for you. So we'll take you, drop you off. You can bring your spouse, your significant other. They can stay here. We have Wi-Fi. We can get them lunch. They can do whatever they want, or if they want to just go out and run the errands and come back, they can do that. Also, monitoring. I also train in general anesthesia, sedation, so I do a full monitoring of our patients, not minimal. You know, we monitor the heart rate, the carbon dioxide, bad air coming out, oxygen, the pulse, and blood pressure, and everything to make sure the patients are monitored fully from A through Z. And we do all hospital-based monitoring in our outpatient surgery center next door. I'm just going to go over a couple of patients we restored. This is a gentleman that came all the way from Bolingbrook to see us. He's, again, 30 years, very fearful, very fearful. This happened because of his fear. In one day, everything was gone, infection gone. We were able to give him teeth. This happened all in one day. Okay. No bone grafting, no sinus slip, nothing. Okay. One surgery, treatment time, 1 day. He lives with fixed teeth. Okay. I want to show this slide of my family. Okay. This is my grandmother. I made dentures for her 3 times. Hated her. Okay. She's still alive, but she doesn't wear them. She doesn't wear dentures. Okay. This is my mother. Okay. This is my mother. This is my father. This is my beautiful wife. My baby. This is me. This is on my birthday not too long ago. The reason why I have this picture is because I feel so passionate about this that I actually did the same procedure for my mother. Okay. My mother had again. She's also a fearful patient. She's had negative dental experiences, and now she actually has fixed lower teeth, and this is what her teeth look like. And I just wanted to show that because it's one thing that I can do my patients, but because I do the same to my family members, my colleagues, and my dad is next. That's something because I believe in it. I just wanted to share that with all you guys. This is another patient of ours, and she's wearing, again, she had an upper partial, the one you have. Husband never saw her without partial. He never saw her without partial. You can see she's a very attractive individual. She had teeth in a day, bad teeth removed, implants placed, and then she wore temporary teeth, and then these are her final teeth. And we noticed that when this happened, people's personalities change. They eat more, they eat right, they exercise, and just they're a complete different side of them come out, and they've been just kind of holding back for years. And she's been told that these teeth have gum disease. She's been told that she's going to lose her teeth, and she's very young. She's in her mid-40s, late 40s. She doesn't want to have dentures. Another patient of ours had failed all teeth, really rotted out underneath, and again, she also had the teeth in a day, where teeth removed, implants placed. And some of these patients most of these patients have their permanent teeth in place, so they've already gone through the healing process. This is the gentleman that came from Bolingbrook, a close-up shot. Another patient of ours wearing partial, had a bunch of spaces, came from Chicago. Okay, we get a lot of patients from Chicago. She also had these teeth removed, implants placed, and these are her teeth right before Thanksgiving. She had said, I want my fixed teeth, I want my permanent teeth before Thanksgiving because I want to be able to enjoy my Thanksgiving dinner. And she did. And we had got her teeth before Thanksgiving. Another patient of ours that had been wearing this temporary bridge for years and years and years. Again, another fearful patient. Didn't want me to examine her because she had such high fear, but after talking to her, after going over with her, she also had, again, bad teeth removed and implants placed, and you can just kind of see how people's face changes once they have this care done. Another, her and her husband both had their care done. She had really, again, they're good patients of ours from Valparaiso, had her upper and lowers all done in one day, and these are her final teeth before she went to Florida for the winter. Another one, these are her temporary teeth. She's from Texas. She just moved here from Texas. She heard about us, and her lower teeth are good. Her upper teeth needed a lot of, and you can see she's very young. She's very young. And again, losing teeth may not be an option. This was just poor genetics. She did everything. She had periodontal disease. The teeth had to go, and we put the implants, and right now she has her temporary teeth. This is a very good patient of ours. Had a very healthy individual. He works out like 6 days a week, and rides his bike 10 miles a day. But his teeth just kind of let his teeth go. His teeth were he had really bad grinding problems. He'd grind his teeth down to a numb. And most of the teeth are decay, so he also had teeth in a day where his teeth were removed and we were able to put in implants in. And another patient of ours, she's just happy as she can be when she had all her upper and lower teeth done. This is the story that you guys need to hear. A young man, this guy was an English teacher in Japan, and we knew what happened in Japan recently, a catastrophe. This was a young man who was an English teacher in Japan. Really he was from Valparaiso. Really wanted to go to law school, but he's 29 years old when he saw us. So he's wearing dentures, and when he was wearing dentures, his denture would fall out, and it really affected his self-esteem and ability to date. He wouldn't meet people. Mom brought him in, and he had all his teeth missing. He placed the implants minimally invasively, and we fit the teeth all in one day. And this is right after his surgery. You can see it's a little bit off because he was numb when he woke up from the sedation. But since then, mom has told us that his life has changed. He's back here. He's applied to law school. He is in law school now. He actually is in a relationship, and his life is just moving forward because he has actually teeth now to chew. And at age 29, wearing dentures is not a very promising for a young man that is just getting started in life. You can see a lot of young patients. This gentleman wanted to have his teeth before he was getting married, so he said, I have to have my teeth healthy for myself and for my spouse, and we tried to make it happen before his wedding. So you can see a very young man in his 20s. A patient of ours who had a full mouth, were just years and years of just bad dentistry and neglect, and again she had all her upper and lower teeth removed, implants placed, and now these are her final teeth. And you can see different ages levels. She had her thing was that I don't want to die with teeth like this, and and I don't want to live with dentures, and she wanted the implants, and she got implants, and you can see these are her permanent teeth. Another patient of ours, similar situation, upper teeth. This gentleman, very nice patient of ours, was very active in his church. Was just not happy with how his upper teeth looked, and he said, I want to fix my upper teeth first. So he had the same teeth in a day procedure, and these are his temporary teeth. He's a speaker at his church, so he talks a lot, and he just didn't want. He would always cover his mouth when he spoke to people. And this is his wife. His wife had her lower teeth done. Another patient, you can see when teeth are missing, the lips just kind of cave in, and how when they're done, how everything just kind of fills out. Another teeth in a day patient, be all on 4 dental implants. Another patient, she actually was supposed to be here, but she couldn't make it. And you can see different age, different people in different walks of life. Tony? This is very important for you guys to understand when you guys go for anywhere else, not just here for consultation. Yes?
No, you're okay.
Okay. What will happen at your initial consultation? It is very important. What will happen at your initial consultation? Okay? Who will do your consultation? There's a big buzz about corporate dental implant centers opening up everywhere. Okay? They've opened up their centers in downtown Chicago, but what they've done was they have opened up what they're called consultation centers in suburbs of Chicago and perhaps maybe in Northwest Indiana. What they don't tell you is that when you go for a consultation to a consultation center, you will never see the person that performs your surgery. You will see what's called a sales consultant. Sales consultant will look at you. My question to my patients are, how can somebody who is not trained in reading 3D scan or even bone biology or anatomy tell you what you can have done? So that person will tell you, okay, it's kind of like cookie cutter formula, one size fits all. Okay, This is what you're going to have done. This is what it's going to cost. Okay, now Mrs. Jones, we're going to schedule you for your surgery in downtown. Okay, we're going to have you stay in downtown at this hotel, blah, 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 blah. Okay, so you are never going to meet that person who does your surgery, your sedation, or fitting the teeth until you come in to downtown Chicago that day of. I don't know, but if I'm having this done for myself or my parents, I would want to meet the doctor who is going to do the surgery on the day of consultation. Okay?
Just out of curiosity,
Yeah.
you're talking about Clear Choice?
Yeah, of
that
course.
has in
Yes,
Schaumburg
absolutely.
and places. Schaumburg, you don't, it isn't a place, it's just a consultant?
They have 1 or 2 surgery centers. The rest of them are all consultation centers. Okay, that's all. How do I know? Because we've had people that have worked there and have come here, and you know, everybody knows everybody in the profession. You know, and we've had patients that have gone there and come here. So this is what I'm just letting people know about the facts. You know, they're great dentists. I'm sure what they do is great, but do understand that you're not talking to the person that is going to be performing a surgery on the day of. You're talking to a non-dental or non-clinician person. And in medicine,
Deceptive, I don't like that.
I'm sorry?
It's
Talk to a
deceptive.
salesman.
It's
Right.
deceptive.
Absolutely. Are you getting the best option or a cookie cutter formula? Scheduling and sequence of appointments, and why is it important to have one doctor, one office, and one team? Because this is another thing that I will tell you. Personally, I know from one center that in 1 year they had 5 doctor turnovers. 5 doctor turnovers. Between oral surgeons and prosthodontists, they had 5 people that turnover because they're being employed by corporate. Corporate is in Denver or corporate is in downtown Chicago. The person who owns it, you know, doesn't know anything about dental implants. Okay, so how is it beneficial to the patient if there's somebody that did this is not general dentistry. This is life-changing event, life-changing surgery. Somebody that does this, well, gee, they're not there a year, 6 months later, a year later. What happens to your care? When you're done with your care, you're pushed off to no man's land, to somewhere else for your care. Whereas here, you're not pushed off to no man's land. We have a full-service dental office that will provide you with a lifetime of follow-up. Okay, so it's just, you know, we're talking about a lifetime of care for our patients, not somebody that'll just do your implants and bye-bye. We don't see you again. That's not our philosophy. Initial consultation, where will it be? Your pre-surgical and prosthetic appointments, where will it be? Okay. Surgical and prosthetic appointments, where will it be? Have I met the surgeon at the initial consult? Post-operative appointments, fitting of all my temporary teeth, where will it be? Starting of my final teeth, routine follow-up, maintenance, where will it be? Those are very, very important questions to ask if you decide to go that route. Is somebody available 24/7, 365? That is very important. Okay, I told you guys that earlier, that I have a call center. If you call the office, the call center can get a hold of me and my other doctors, and we will call the patient immediately. If there's any complication, who do you call on the weekend? Okay, if you call the center and they have an answering service, I'm sorry, but you're going to be in pain. Okay, what experience does a clinician have in case planning? How many have they done? Okay, how many of these cases have the doctor or prosthodontist surgically restored? What is their success rate? Not the success rate of the method. What is their success rate in their hand? That is very, very important. Not Dr. Malo's success rate. What is their success rate? And how long has the doctor been with the office or with the center? I just talked about in 1 year they had 5 doctor turnover. Now, my final message is that it's time to think about you. You know, your teeth, your health, your livelihood. You know, we can help. My team can help, and you know, whatever we can do to give you the options, to give you what we can do to provide the best possible care, we're here for you. You know, you're going to be able to, Jen is going to take you back, you're going to be able to meet some other doctor. We have some food over here, so make yourself at home. You know, we can even take a 3D scan for you, and we do that as complimentary for our patients to see what they're a candidate for, and we'll take it from there. Does anybody have any questions or any concerns?
I just got one question.
Sure.
Because you said you give pain medication during, like, when you put somebody under?
In
Yeah.
the IV.
What kind of pain medication do you use?
I use opiates. Are you in healthcare? Are you
No,
know?
but I just can't take hardly any pain medications because they make me sick.
Okay.
And I was wondering what, I mean, I've had probably sodium pentothal, but that's not pain medication.
Fentanyl is an opioid, and it goes in the pain receptor. It alleviates pain. Also, it helps with the sedation. We give Decadron. Decadron is to decrease it's a steroid to help the swelling. We also give ibuprofen, through the IV. So, but we have to look at patients' medical history as to see what if they're not allergic to it, we don't give it. But
Yeah.
fentanyl is across the board. They get it because people are not allergic to it. It gives patients a nice level of
Fentanyl?
comfort.
I don't know that I've ever had that one.
With the all-on-4 procedure, what's a time frame? How long would that take if that was something?
If you had, there's two types of all-on-4 patients. People that have bombed out teeth and they need to have their teeth removed and implants placed and temporary teeth fitted, or people that already have all their teeth missing, they're wearing dentures. Okay, if you already wear dentures and if you are a good candidate, we can place your implants through a pre-made surgical guide. It's very precise and it's very minimally invasive. Okay, so pretty much all within a day or two.
But how long would the actual procedure take?
In the office?
Yes.
It could take 4 hours, 5 hours, 6 hours. The first appointment is always the longest because the sedation, placing the implants, putting the abutment. So the first appointment always is the longest.
But you're under sleep, so you don't know it.
Right.
So-
How long are you under sometimes? 4 or 5 hours?
We have patients under for 8 hours.
Oh, really? Oh.
It
But
depends
it's-
on how long it takes to remove the
just kinda
teeth
wake
and
up and you-
then drill the new holes and put the pieces in.
What kind of plugs do you put in them holes?
Tooth color porcelain.
No, he's talking about the plugs that are inside.
Yeah.
Yeah, tooth
No,
color.
no, I'm talking about you gotta have the screws. Now this is regular
Secure.
denture.
It's not denture. It's a fixed implant bridge.
Okay, but it's made from the same material.
It's made. The first set of teeth is made from acrylic. Okay, which is same as a denture material or the acrylic that's in a cockpit of an airplane. The second set of teeth is made out of porcelain acrylic, and then there's a titanium framework on the inside for support.
How's the first teeth are put on, how do you keep them in there?
They're secured.
They're secured, and then you just kind of unsecure?
No, you don't take, these are non-removable.
Right, but when you
But
put
the
the
first
permanent
set.
teeth in, then you just remove those.
Remove them and we go through a series of appointments to go through the fitting of the permanent teeth. See, when we look at, it's one thing to do the implant surgery, then it's one thing to fit the teeth. We look at each patient's individually, their facial profile, their eyes, okay, their complexion, we take a full measurement of nose and everything. There's a lot of detail that goes into teeth selection, okay. So these teeth are secured. You have the implants, you have the abutment that will hold your teeth, and the teeth go on top of the abutment. They're secured.
Do you have to be put to sleep for that?
No. No, not only for the first appointment.
How do you maintain the dental implants once they're in place?
The dental implants, when they're in the bone, you don't need to maintain it because it's biological. But this is maintained very simply with brushing. This is one unit connected, so you can't floss, but we give you a water pick. We give you a water pick to get underneath and get everything cleaned out.
So you can use the sonic toothbrush on it?
You can use a sonic toothpaste as long as it's not abrasive toothpaste.
Abrasive
I've had
toothpaste.
periodontal problems numerous times. It won't have, nothing like that would ever come back again since you don't have your teeth?
No.
Okay.
So nothing, you're talking about, you said using a water pick so nothing gets underneath, but could anything get, like if you didn't do those things, could you get an infection or something in your gum that those implants would have to come out or anything, or?
Once the implants are integrated, the only way you can get an infection around the implant is you in the first 30 days you weren't careful. The implant surfaces are so evolved as the minute we put it in, the bone starts to grow around immediately. It's called osseointegration. Okay, so the only way you can get most infections happen on top of the implant where it comes out of the gums, not in the bone, because that's all sterile. That's all sterile environment. On top of the gums where it's exposed to the saliva, that's not sterile. Okay, so the infection occurs right over here. It's called peri-implantitis, meaning infection around the implant on the outside. That only occurs if you don't take care of your teeth and if you let your plaque build up. Okay, does that mean you're going to lose an implant? No. That means we may have to take the abutment out, clean everything out, maybe put some medicine in and put an abutment back on, that's all. But that is in very rare cases. Most patients, when we do this, we go through our hygienist, which you'll meet, Leslie, will go through meticulous hygiene instruction with you, meticulous hygiene instructions.
So you can, if this breaks,
If the temporary teeth breaks, which it can, we can repair it. The permanent teeth will not break because it would only break if you get into an auto accident. But it will not break like by chewing on something. If you get into an auto accident, if
so it
this,
doesn't age?
if you hit a steering wheel, if this thing breaks, this thing will break, but the titanium won't. It's titanium on the inside; it won't break. So we'll just have to get it, take the thing out, send it back to the lab.
But is there a wear, like a 10-year or something on these? I mean, because you have teeth there that, can't they come out just like on a denture or something?
These teeth will not because they are reinforced in the lab. They're not. Your final teeth are not denture teeth. They're actually porcelain acrylic. Okay, they're not really. They are not. I'll make it very clear. They are not denture teeth. Denture teeth can break. These are reinforced resin, and so they're acrylic porcelain. They are in the metal framework inside that is embedded inside the acrylic porcelain, so they don't break. They will only break if again you get into an auto accident. We have people that chew nuts, cashews, ice, and everything, and these teeth don't break. Could you get wear? Yeah, you probably will get wear if you grind, if you bite pencils, and so that's why we make a night guard or a bite guard for every patient that we do this for, just to protect the teeth.
So you get plaque filled up with this as well as you do?
You can get it around the gum line if you're not using the water pick. The maintenance is the simplest thing. Water pick, toothbrush. That's it.
Just like
And regular
teeth.
Yeah.
No flossing.
No flossing.
So you wear a mouth guard at night when you have those?
Yeah, night guard. Night guard.
Night guard.
We do tell the patients to wear the night guard at night to prevent destructive forces on the teeth and also on the jaw joint. Because when patients that don't have teeth, now when they have teeth, they automatically are going to clench and grind. So at least for the first few years, we tell the patients to wear night guard.
I think you just do that now because I do it now that I have dentures.
I'm sorry?
Now that I have the dentures, I
Right.
think it's just a reflex from not having your own teeth, that at night I push down really hard on my molars. And,
Okay.
feeling like I have to have it pushed down real hard. I don't know,
Sure.
it's like your jaw hurts in the morning from doing it.
Sure.
Doctor, we're ready
my
to
answer
switch
yet.
the groups if
Sure.
you are.
Yeah. Please
I
make
still ain't got
make
my
So if you
answer
wanna
of
come
how
with me,
much.
we're going to
What's
let
that?
you have a
Still
tour
ain't
of
got
the
my answer of
facility,
how much.
have some
Okay.
snacks, and then get your complimentary ICAT scan as well as visit with some of our patients that have been
He's got a
patients
question.
here
A single tooth are you talking about?
Well, what would it cost for that?
Every patient is different. I'll give you cost ranges. A single tooth implant, and then when I say an implant, from start to finish, from the surgery to the tooth to the abutment, could be between $3,000 to $4,000. Okay, from a simplest thing, a two implant snap-on denture. Okay, the simplest thing in dentistry. Somebody's missing teeth, and they want something better than a denture. This is not the all-on-4. This is just two implant snap-on. From a two implant snap-on all the way up to a zygomatic with long implants and fixed implant, could anywhere between 12 all the way to 28,000. I mean, it's just a broad range. So every patient is different. If you had traditional approaches, where what she had done, hip graft, sinus lift, bone graft, individual implants, by the time you start, the time you finish, you're looking at anywhere between 40 to 50,000 just for one arch. You're looking at 70 to 80,000 for a full mouth solution. Those days are gone. You don't need to spend that much. You don't need to spend that much time and money and investment and non-minimally invasive methods to have your function back.
Okay,
Are you saying that max for a whole top would be 28,000?
No, for an arch, for one arch. I'm talking about the highest that you will have, maybe 28 to 29,000 for long implants and 6 implants, and from temporary to fixed teeth. Okay, this is somebody that has no bone to long implants per arch, meaning one jaw.
When we schedule an individual consultation, then you'd probably be
Yeah,
able to
then
give us
you'll know
more
exactly.
accurate.
Exactly.
Okay, I'm just wondering, let's say if I just remove the whole top and just go with the top.
Again, I don't know if you will be a traditional all-on-4. I don't know if you will be the long zygomatic. Until I have a scan, I don't know what again, I don't know what, again, I'm giving you ballpark ranges, I don't know what I'm looking at.
So if you got a scan tonight, could you tell us?
Oh, when you get a scan tonight, what
Yes.
they're gonna do is they're gonna tell you is after we get a scan, we're actually gonna set up a time for you to come in so I can individually spend the time with you. Because right now, it's hard for me to give individual attention to everybody in a setting like this. Okay? Great. Thank you very much.
If you
Enjoy
guys want to
yourself.
follow me, we'll go this way.
Gee, Doc, Dr. Meister was